it is consumed over long periods of time. The prolonged use of the drug produces addiction, produces roughly approximately the following effects: emaciation, patient is wasted, appetite उसकी खत्म हो जाती है, and the muscles are broken down to make more glucose because patient is not eating very well, not eating at all actually, very little diet because it stimulates the satiety center and one does not feel hungry. So patient becomes emaciated and dry skin and hair, dehydration, loss of water intake, also uh, protein malnutrition, pigmentation around the mouth and eyelids, dry and hurt tongue due to vitamin deficiency, anorexia, nausea, and marked constipation slows down the GI tract, and impotence, neurasthenia, weakness of the nerves, dementia, or mania. So the person has become addicted, and you try to take that person off the opium. What are the symptoms, the withdrawal symptoms that are going to occur? When opium ingestion is stopped, in the first few hours, there are psychological effects due to fear and anxiety. During the first 8 to 16 hours, there is nervousness, restlessness, anxiety. At 14 hours, there is yawning, sweating, and running of the eyes and nose. Everything starts to go in the opposite direction. So there is excessive salivation, lacrimation, and there is the diarrhea starts. Whatever the effects are of the opium intake, all those effects are reversed in the withdrawal, and they are very severe. And one major effect, that is pain. There's a lot of pain because the opioids, they are analgesics, very powerful analgesics, and they relieve pain. So during the withdrawal period, there is very severe pain. 24 hours at 24 hours, the pupils become dilated. There is loose skin and shivering. At 36 hours, there is severe twitching of the muscles, painful cramps in the legs and abdomen. There is vomiting, diarrhea, and insomnia. And at about 3 to 4 days, the symptoms gradually subside. So the withdrawal is very severe for up to 3 to 4 days. So you have to manage the patient during the withdrawal. The first 3 or 4 days during detoxification are critical, in which the patient needs very closely applied medical attention. How would you treat the withdrawal symptoms? First of all, the opiates should be gradually withdrawn. Then you use cyclazocine 4 milligrams to be given daily. What is cyclazocine? It is a mixed opioid agonist and antagonist related to dazosine, pentazocine, and these are synthetic opioids. So they are going to keep on stimulating uh, the opioid receptors, and also they will antagonize the opioid receptors as well as stimulating them. It is a mixed agonist antagonist, so doesn't have addictive potential, but it's going to tone down the effects of the withdrawal. वो इतना इतना एगनाइज नहीं करता, इतना ज़्यादा स्टिमुलेट नहीं करता ओपियोइड रिसेप्टर, थोड़ा सा एंटागनाइज करता है, थोड़ा सा उसको स्टिमुलेट करेगा, तो विड्रॉल्स की सिवेरिटी जो है ना वो कम होगी. दिस फैमिली ऑफ ओपियोइड ड्रग्स इज कॉल्ड बेंजोमॉर्फिन, and it is a kappa opioid receptor agonist and a mu opioid receptor partial agonist, and also has high affinity for delta opioid receptors. Then you can give methadone. Methadone 100 milligrams daily orally. 1 milligram of methadone equals 4 milligram of morphine or 20 milligrams of petadine. ये भी opioid agonist है, लेकिन इसमें addictive potential कम है than morphine. आपने gradually, और उसके यूफोरिक इफेक्ट्स इतने ज़्यादा नहीं होते मेथाडोन, इसलिए यू कैन यूज मेथाडोन, इतना ज़्यादा एडिक्टिव नहीं है, लेकिन ये विड्रॉल और ओपियोइड विड्रॉल के जो इफेक्ट्स हैं उसको कम करेगा. देन यू कैन use methadone maintenance. It is usually used for IV heroin users. Methadone maintenance units differ in their selection procedures, dose, duration of treatment, their philosophy and rules, as well as ancillary method of treatment. It is the treatment of first choice and among other methods, it enjoys a higher retention rate of clients due to its effectiveness. Methadone was synthesized by a German scientist again and came uh, and was brought into clinical use at the end of World War II. Methadone hydrochloride is a bitter white powder that is soluble in water and ethanol. Under the trade name, it is known as Dolphin and Vestadone. It is available as 5 milligram and 10 milligrams tablets for oral use, and for 12 milligrams per ml injections can be given IV. Now, after a subcutaneous injection, methadone can be found in the plasma within 10 minutes, and after oral injection, it is found after 30 minutes. The peak concentration occurs within 4 hours, whereas in the brain, the peak is in 1 to 2 hours. Methadone is an antidote of morphine, but due to its own depressive action on respiration, other side effects has made it unsuitable for the purpose. लेकिन इसका साइड इफेक्ट मेजर है रेस्पिरेटरी डिप्रेशन ऑलरेडी ओपियोइड विड्रॉल अगर आप इसको ज़्यादा देते हैं तो ये पेशेंट है उसकी डेथ हो सकती है इसलिए इसका यूज़ इतना पॉपुलर नहीं है इट इज़ a synthetic opioid and is a narcotic agent. After use of methadone, patient should take bed rest. Movement precipitates dangerous side effects. Side effects of methadone are excessive sweating, lymphocytosis, increased prolactin, albumin, and globulin in the plasma. In the urine, the metabolites of methadone are excreted as pyrrolidine and pyrroline. Then you can use clonidine, which is a centrally acting alpha adrenergic agonist, and it can suppress the opioid withdrawal from low to moderate doses of methadone. It is a potent antihypertensive. Then propranolol can be used 80 milligram effectively relieves anxiety and craving associated with opioid addiction. The mainstay of treatment is naloxone. It is a semi-synthetic opioid. It causes analgesia, respiratory depression, dysphoria, and hallucinations. It was popularly used एज अ एंटीडोट ऑफ मॉर्फिन ये पुराने ज़माने में इस्तेमाल किया जाता था अब नहीं इस्तेमाल होता बट ओन डिप्रेसिव एक्शन ऑन रेस्पिरेशन and other side effects has been unsuitable for the purpose. Naloxone hydrochloride 5 milligram IV is given for 15 to 30 minutes, then 10 milligram IV to a total dose of 40 milligram IV. आजकल जो इस्तेमाल किया जो दैट इज naloxone hydrochloride 0.4 to 0.8 milligrams intramuscular or intravenous is given in adults and 0.01 milligram per kg is given in children. Psychological counseling of the patient has an important role. ये तो acute withdrawal को आपने ऐसे मैनेज कर heroin main चीज है heroin addiction. Heroin is known as chemically is known as diacetyl morphine. This is a semi-synthetic preparation of morphine. It was first prepared at the St. Mary's Hospital in London by acetylation of morphine with acetic anhydride in 1898. Morphine was first used for the treatment of cough, but soon it became the most potent drug used by drug addicts due to its habit-forming properties. Manufacture of heroin and its use in medicine is banned nowadays, but it is being illegally manufactured and smuggled as its cost is very high in the international market, as everybody knows. Brown sugar is also called smack. Its color is brown due to the presence of sugar, of milk, starch, powdered coffee, tea, and cocoa or brick powder. Brown sugar is sold in a small cellophane packets of 116 grams each. The amount of heroin in each packet may be 1/16th of the packet, 1/18th of 116 grams, 1/16th of 116 gram, 1/18th of one or half of a gram. These cellophane bags are kept in a matchbox to avoid suspicion. What are routes of consumption? इसको स्निफ किया जा सकता है इन द फॉर्म ऑफ अ स्नफ स्नफ बॉक्स जो है ये वो कहते हैं कि ये जो अंगूठा है इसके इसके अंदर टेंडन है, इसके दरमियान एक डिप्रेशन सा बन जाता है, उसके अंदर रख के इसको स्निफ किया जाता है. Then it can be smoked in cigarettes or बीड़ीज after removal of some tobacco. थोड़ा सा टोबैको रहने दिया जाता है, उसके अंदर बाकी हेरोइन डाल दी जाती है. चेसिंग एक चीज है, cigarette foil or a 5 rupee note or a 10 rupee note is folded and instead of tobacco the drug is put inside. This is then lighted using a matchstick, then thick smoke comes out which is inhaled. This is known as dragon chasing. या फिर इंजेक्शन लगाए जाते हैं, सबक्यूटेनियस इंजेक्शन जो लगाता है उसको कहते हैं स्किन पॉपर्स. एंड आईवी रूट जो इंट्रावीनसली इंजेक्ट करते हैं हेरोइन को, उनको मेन लाइनर्स कहते हैं. इनके बारे में नोट आ जाता है आपको कभी कभी, स्किन पॉपर्स क्या चीज़ है, मेन लाइनर्स क्या चीज़ है. तो ये ड्रैगन चेसिंग है. या सिगरेट फॉइल में इसको जला के इसके फ्यूम्स को इनहेल किया जाता है, या स्मोक किया जाता है, या इस तरह के स्पून के अंदर डाल के इसको हीट अप किया जाता है और जो इसके फ्यूम्स हैं उसको इनहेल किया जाता है. ये आईवी लाइन के जरिए से मेन लाइनर है आईवी. और ये स्किन पॉपर्स ये सबक्यूटेनियसली इंजेक्ट की है, जहाँ जहाँ इंजेक्ट किए वहाँ वहाँ निशान पड़ जाते हैं स्किन में, पिगमेंटेशन हो जाती है और मुख्तलिफ किस्म के इफेक्ट्स होते हैं. तो इस तरह की कंडीशन, ये जो है ना, ये इसको स्किन पॉपर्स कहते हैं. ये स्किन पॉपर देखो, जहाँ जहाँ हेरोइन इंजेक्ट किए वो लीजन्स बन गए वहाँ स्किन पे, गोल गोल डार्क पिगमेंटेड लीजन्स. These are skin poppers. So what are signs and symptoms of heroin uh, intake? Number one, anorexia, nausea, vomiting because of the stimulation of the chemoreceptor trigger zone. Then constipation, emaciation, pigmentation around the cheek, impotency. What are various complications of consumption? एब्सेस फॉर्मेशन हो सकता है along the routes of injection. जहाँ जहाँ आपने सबक्यूटेनियसली इंजेक्ट किया वहाँ एब्सेस बन सकता है. ये नीडल जो है वो स्टेरिलाइजेशन का सही मेथड नहीं होता. नीडल से बैक्टीरियल इन्फेक्शन या सेल्यूलाइटिस हो सकता है, एब्सेस बन सकता है on the site of injection. Formation of pigmented scars in the cubital fossa. These are described as railroad track lesions. Then thrombosed veins. The veins can thrombose, जिससे काफ़ी सीरियस कॉम्प्लिकेशन हो सकती है, एम्पुटेशन भी करनी पड़ सकती है आर्म की. अगर वेन जो है वो बिल्कुल थ्रोम्बोज होकर उसमें ब्लड सप्लाई रुक गई है. सेप्टिसीमिया, आप डायरेक्ट अगर इन्फेक्टेड नीडल आप ब्लड में डाल रहे हैं तो इंट्रोड्यूस द बैक्टीरिया इन द ब्लड स्ट्रीम एंड इट कैन कॉज वाइड स्प्रेड infection, septicemia, and death. Then AIDS and hepatitis can be transmitted through sharing needles. These are the complications of consumption. हाउ इज द स्मगलिंग ऑफ हेरोइन डन? ये दो तरीकों से होती है. एक बॉडी पैकर्स होते हैं, बॉडी स्टफर्स. ये आगे मैं बताता हूँ. हेरोइन को इस तरह के प्लास्टिक के बैग्स में स्टफ भर के तो वो इंजेस्ट कर लिए जाते हैं ये पैकेट्स, और इंटेस्टाइन के अंदर आपके चले जाते हैं और फिर इस तरह इनको ट्रांसपोर्ट किया जाता है. तो इसमें रिस्क बहुत है, अगर ये फट जाए तो बड़ी टॉक्सिक डोज जो है हेरोइन की हो जा सकती है. ये देखें, एक बंदा उसको मारा, उसके एयरपोर्ट पे उसको देखा कि उसके इंटेस्टाइन में ये चीज़ें हैं, ये लिफाफे हैं, प्लास्टिक के लिफाफे कमिंग आउट ऑफ द इंटेस्टाइन. जब उसकी टॉप्सी की गई द पर्सन वाज किल्ड. और वैसे भी वो मर ही रहा था क्योंकि ये एक बैग फट गया था अंदर टॉक्सिक डोज की वजह से. तो जब उसको मार के उसकी टॉप्सी की तो उसका जो इंटेस्टाइन निकाला तो यू कैन सी कि इसमें से प्लास्टिक के बैग निकल रहे हैं ये सारे प्रेजेंट इन इंटेस्टाइन. Pethidine. Now we come to pethidine. It is also known as heparidine or demerol. It is a synthetic opioid and it is a narcotic. Some of its actions are in variation with morphine. It is a good analgesic and sedative. In contrast to the action of morphine, it is a mydriatic. ये वाहिद ये one of the few opioids है which cause mydriasis, dilation of the pupil. All the others they cause constriction of the pupil. It causes dryness of the skin. It has direct action on heart musculature which it inhibits. Excuse me. It liberates histamine from mast cells. Pethidine causes early loss of the corneal reflex due to its anesthetic effects on the cornea. It is highly addictive and doctors and paramedical workers are common victims. Pethidine is therapeutically contraindicated in cases of high intracranial pressure. It's also not given in toxemia of pregnancy. Then we come to codeine. Codeine is methyl morphine. It possesses analgesic and antitussive properties. कॉफ को suppress करने के लिए बच्चों की कॉफ सिरप्स में कोडीन होता है. It is less potent than morphine. 120 milligrams of codeine produces the same degree of analgesia as 10 milligrams of morphine. The tolerance does not develop as rapidly with codeine compared to morphine. Lethal dose is between 500 milligrams to 1 gram. Acute toxic ingestion causes coma, meiosis, and respiratory depression. अब ये कुछ क्वेश्चन हैं जो कि इम्पोर्टेंट है, उनमें कुछ अच्छी इंफॉर्मेशन है इसलिए मैं आपको ये बता रहा हूँ. What are opioids? These are naturally occurring or synthetic drugs that have opium-like activity. How do opioids exist in the central and peripheral nervous systems and the GI tract? What are the three main receptors activated? Opioid 1 are known as delta receptors, opioid 2 receptors are known as kappa receptors, opioid 3 receptors are known as mu receptors. What are the clinical effects of opiate administration? There is analgesia, relief of pain, drowsiness, changes in mood, often euphoria. What triad of symptoms strongly suggests opioid intoxication? CNS depression, constriction of the pupil, and respiratory depression. These are the three main features of opioid intoxication. Which opioids are not associated with meiosis? Propoxyphene में पैथिडीन जो भी हमने डिस्कस किया. What are the cardiovascular tramadol? What are the cardiovascular effects of opioid overdose? There is hypotension and grade bradycardia which may be mild or absent. What are the dermatological symptoms? Flushing, pruritus may be present. What are other respiratory effects of opioid intoxication? Respiratory depression, bronchospasm, and non-cardiogenic pulmonary edema. ये बड़ा important. Non-cardiogenic pulmonary edema करता है opioid. Fentanyl administration may be associated with chest wall rigidity. What are the GI effects? Nausea, vomiting, and constipation. What is the cause of most opioid-related deaths? It is respiratory depression resulting in anoxia. How do opiates cause respiratory depression? It has a direct effect on the brainstem respiratory centers through mu and delta receptors. ये receptor stimulate होते हैं तो respiratory center depressed हो जाता है. They have inhibitory action. They release inhibitory neurotransmitter. जब ये receptors activate होते हैं and they depress the respiratory center. What are the primary metabolites of heroin? 6 monoacetyl morphine. And what is the paralytic infection? What paralytic infection is associated with the use of black tar heroin? This is known as wound botulism. और इसका जो organism है that is Clostridium botulinum. Which opioid has cardiac fast sodium channel blocking properties? Propoxyphene and its metabolite norpropoxyphene, both of which cause QRS prolongation. Which opioid has unique interaction with monoamine oxidase inhibitor? Meperidine, it can cause serotonin syndrome. What is the opioid antagonist that is used to treat acute toxicity? Naloxone, it competitively binds the opioid receptor. It does not allow the opioids to bind with the receptor. It competitively ब्लॉक कर देता है, वो बाइंड नहीं कर सकते तो वो उनका इफेक्ट नहीं आता. It is the only antagonist, naloxone. What is the normal elimination half-life of naloxone? 50 to 60 minutes. What medical condition results in prolongation of elimination half-life of naloxone? If the person suffering from renal failure, then naloxone can be toxic. What are body packers? Individuals who swallow wrap packets of illicit drugs or insert such packets into body orifices. These are known as body packers. Most are asymptomatic but can have acute intoxication with rupture of the packets. If suspected, abdominal radiographs may be obtained, but packets present are not always radio opaque. Consider whole bowel irrigation with polyethylene glycol. Surgical indications include bowel obstruction and intestinal perforation हो सकती है, bowel obstruction हो सकती है. इस केस में सर्जरी करनी पड़ जाती है. Continuous infusion of naloxone may be indicated with rupture of the heroin packets. बड़ी टॉक्सिक डोज रिलीज हो रही होती है. What are body stuffers? Individuals who swallow poorly wrapped or unwrapped drugs, usually in an attempt to avoid arrest. There is generally more likelihood of becoming symptomatic secondary to the exposure to the intestinal lumen. जल्दी में जो हेरोइन को छुपाने के लिए खा लेते हैं उनको कहते हैं बॉडी स्टफर्स, और जो प्लान करके खाते हैं उसको कहते हैं बॉडी पैकर्स. What are the three main opioid receptors? Delta, kappa, and mu. What are some slang terms for various opiates? China white भी कहते हैं इसको, ब्राउन भी कहते हैं, सुपर ब्यूइक भी कहते हैं, ब्लैक tar, हॉट शॉट, बर्ड्स आई, इसके ट्रेड नेम. Homicide. How are opioids abused? Depending on the specific substance, opioids can be insufflated, inhaled, injected, smoked, or taken orally. What is the opioid toxidrome? तो कौन सा सिंड्रोम होता है, टॉक्सिक सिंड्रोम? इट इज CNS and respiratory infection with myotic pupils. अब ओपिएट्स और ओपियोइड्स में क्या फर्क है? ओपिएट्स आर स्पेसिफिक सब्सटेंसेस डिराइव्ड फ्रॉम द ओपियम पॉपी. जो पॉपी से निकल रहे हैं वो ओपिएट्स हैं. ओपियोइड्स इंक्लूड ऑल सब्सटेंसेस बोथ नेचुरल एंड सिंथेटिक. The opiates are only the naturally occurring alkaloids coming from the poppy plant. Opioid में दोनों आ जाते हैं, natural और synthetic, that are capable of producing opium-like effects. सेमी सिंथेटिक और सिंथेटिक, ये अगर सब सारों में यूज करें तो ओपियोइड्स हैं. अगर खाली नेचुरली करेंगे आप इस्तेमाल करें तो वो ओपिएट्स. With opioid urine drug screens, what three opioids are reliably detected? These screens detect morphine metabolites. Therefore, only morphine as well as heroin and codeine, both of which are metabolized to morphine, are detected by such screens. Other opioids, that is fentanyl, oxycodone, hydrocodone, meperidine, ये synthetic है ना, वो detect ही naturally occurring, और semi synthetic जो है ना वो उनके मेटाबोलाइट्स आप डिटेक्ट कर सकते हैं ये ड्रग स्क्रीन्स के अंदर. Which synthetic opioid should be avoided in patients taking monoamine oxidase, and why? Meperidine. With monoamine oxidase inhibitors, they block the effect of serotonin, and the interaction between meperidine and the serotonin receptors could induce serotonin-like syndrome. ये छोड़ देंगे, आपसे कंसर्न नहीं है. How are opioids metabolized and excreted? They are metabolized in the liver and excreted in the kidney. What percentage of population lacks the ability to metabolize protein to morphine? 7% of the Caucasian population lacks the appropriate enzyme CYP2D6. Naloxone is the antidote, should be given slowly, 0.4 milligrams over a few minutes and titrated with return of spontaneous respiratory effort. As the half-life of naloxone is shorter than most of the opioids, the patient should be monitored for resedation or development of opioid-induced non-cardiogenic pulmonary edema. ये naloxone का मेन साइड इफेक्ट, इसको आपने वॉच करना है, पेशेंट इसके तो नहीं जा रहा. Typically manifesting within 4 hours in people with normal brain function. Primarily, general treatment में supportive care आ जाता है. Respiratory depression will be the main concern. Naloxone may be used as a diagnostic tool or to avoid intubation. Uh, Other than respiratory depression, what acute pulmonary complication is non-cardiogenic pulmonary edema? What are signs of withdrawal? CNS excitation, for restlessness, agitation, anxiety, dysphoria, nausea, vomiting, abdominal cramps, diarrhea, piloerection, lacrimation, rhinorrhea, diaphoresis, and fever. AMS and fever are not associated with opioid withdrawal, and those signs should prompt further diagnostic tests. Which medications have been used to alleviate opioid withdrawals? Methadone, clonidine, buspirone. Meperidine or pethidine does not cause meiosis. They cause mydriasis, propoxyphene, and tramadol. They all do not cause meiosis. अब थोड़ा ड्रग डिपेंडेंस और ड्रग एडिक्शन की तरफ आते हैं. उसमें कुछ डेफिनेशन इंपॉर्टेंट है. What is the definition of drug? Any substance when taken into the living body may modify, which it can modify or may modify one or more of its function is known as a drug. Any substance when taken into the living body may modify one or more of its function. This is known as a drug. What is the definition of a psychoactive drug? Psychoactive drug is the one that is capable of altering mental functioning. What is drug dependence? Drug dependence is a compulsion to take a drug to produce a desired effect or to prevent unpleasant effects when the drug is withheld. ये दो चीजें. एक तो इट इज अ कंपल्शन, आप मजबूर हैं उसको लेने के लिए, produce desired effect, yeah, to prevent unpleasant effects if the drug is not given to you. It is necessary for either physical or psychological well-being of the person. Drug dependence includes both terms, addiction as well as habituation. There is a difference between addiction and habituation. इसमें आप देख लें, addiction is more severe condition, habituation is less severe. Habituation में आप आदी हो जाते हैं कुछ ड्रग्स, लेकिन उसमें सिवियरिटी एडिक्शन जैसी नहीं होती. जैसे आप कॉफ़ी के कैफीन के भी आदी हो जाते हैं, चरस के भी लोग आदी हो जाते हैं. लोग हैबिचुएटेड होते हैं लेकिन एडिक्ट नहीं होते. फर्क क्या है एडिक्शन और हैबिचुएशन में? कंपल्शन इज ओनली प्रेजेंट इन एडिक्शन. मतलब बस मजबूर होता है, उसने लेनी लेनी चाहिए. इसमें रेजिस्ट कर सकता है. देयर इज डिजायर टू टेक द ड्रग बट देयर इज नो कंपल्शन. बैक बोरो स्टील नहीं करेगा, किसी को नुकसान नहीं पहुंचाएगा हैबिचुएशन टू गेट द ड्रग. डिपेंडेंस क्या है? इट इज डिपेंडेंस कौन सी है इन ड्रग एडिक्शन? दोनों किस्म की, साइकोलॉजिकल एज वेल एज फिजिकल. फिजिकल इफेक्ट्स होंगे अगर वो ड्रग नहीं लेगा. हैबिचुएशन में देर आर ओनली साइकोलॉजिकल इफेक्ट्स जिससे वो सफर करेगा, फिजिकल इफेक्ट्स नहीं होंगे. There is a tendency to increase the dose in drug addiction, and there is no tendency to increase in habituation. Withdrawals, characteristic withdrawal symptoms होंगे drug addiction. Habituation में withdrawal symptoms सच नहीं होंगे, बल्कि थोड़े से होंगे या mild होंगे. There is harm in drug addiction to both the individual and society. Society के लोगों को भी harm करेगा जो ड्रग एडिक्ट है, लेकिन ये सिर्फ इंडिविजुअल को हार्म करेगा. हैबिचुएशन सोसाइटी को हार्म नहीं करेगा. Nowadays, the words addiction and addict are not used in medicine due to their derogatory implications. Instead, abuse or harmful use or drug dependence is used. So there are two types of drugs, hard and soft drugs. They are terms to distinguish between psychoactive drugs that are addictive and non-addictive. Hard drugs, they lead to severe physical addiction. For example, heroin, methamphetamine, alcohol, and nicotine. These are hard drugs which they lead to severe physical addiction. Soft drugs that do not cause physical addiction but may lead to psychological dependence. For example, cannabis, mescaline, psilocybin, hallucinogens है, LSD, lysergic acid diethylamide. The distinction between soft and hard drug is important in the drug policy of the Netherlands, where cannabis production, retailing, and use comes under official tolerance and is subject to certain criteria. वहाँ चरस जो है वो लीगल है हॉलैंड में, इसलिए क्योंकि it is considered as a soft drug. What are patterns of drug use disorders? There are four important patterns of drug use disorders which may overlap with each other. Number one is acute intoxication. Number two is withdrawal state. Number three is dependence syndrome. Number four is harmful use. So, what is acute intoxication? It is a transient condition resulting in disturbance of the level of consciousness, cognition, perception, behavior, other psychophysiological functions, and responses. This is usually associated with high blood levels of the psychoactive substance. The intensity of intoxication lessens with time, and effects gradually disappear in the absence of further use of the substance. The recovery is complete, except where tissue damage or some complication has arisen. ज़्यादा डोज ले ली उसके acute effects आ रहे हैं, आहिस्ता आहिस्ता वो खत्म हो जाते हैं, ये acute intoxication. The withdrawal state is characterized by a group of symptoms often specific to the drug use which develop on total or partial withdrawal of the drug, usually after repeated or high dose use. The duration usually is of a few hours to a few days. Typically, the patient reports that withdrawal symptoms are relieved by further substance use. What is dependence syndrome? It is a cluster of physiological, behavioral, and cognitive phenomena in which the use of substances taken takes on a much higher priority for a given individual than other behaviors that once had greater value. यानी कि रिश्ते नाते हर चीज खत्म हो जाती है, ना माँ बाप रहता है ना भाई बहन रहता है, तो मेन ऑब्जेक्टिव बन जाता है बंदे का ड्रग. ड्रग उसका जिंदगी का जो है ना सेंटर पॉइंट बन जाता है. All other things are secondary to of the acquisition of that substance. वो मैनिपुलेट करेगा अपने रिश्तों को भी, अपने भाई बहनों को भी, अपने माँ बाप को भी, सारे रिश्तों को मैनिपुलेट करेगा in order to get the drug, because the drug has become the center of everything. तो उसकी प्रायोरिटी बन जाती है ड्रग. This is dependence syndrome. It is characterized by the desire, overpowering and strong desire to take psychoactive drugs, for example, alcohol or tobacco, heroin. Harmful use क्या है? Continued drug use despite awareness of harmful medical or social effects of the drug being used. तो पता है कि ये मुझे destroy कर रही है, मेरे life को destroy कर रही है, लेकिन still the person keeps on taking the drug, or a pattern of physically hazardous use of the drug. For example, driving during intoxication. इसको पता है कि ड्रंक ड्राइविंग नहीं कर सकता, अल्कोहल पी के मैं ड्राइव करूंगा cause serious harm, लेकिन could cause the death of me, that person and also others. लेकिन the person continues to do it. The diagnosis requires that the actual damage should have been caused to the mental or physical health of the abuser. Harmful use is not diagnostic if dependent syndrome is present. DSM-4 criteria क्या है for the diagnosis of substance dependence? इसमें it is based on the presence of at least three symptoms occurring at any time in a 12 month period. Number one, tolerance. टॉलरेंस का कि वो इफेक्ट नहीं आ रहा होता है, डोज आप बढ़ाते जाते हैं तो वही इफेक्ट ज़्यादा डोज पे आता है, इसका मतलब आपको टॉलरेंस डेवलप होगी. इसके बाद विड्रॉल क्या है? जब आप छोड़ते हैं या कम करते हैं ड्रग तो आपको विड्रॉल सिम्टम लगता है। नंबर 3, एडमिनिस्ट्रेशन ऑफ लार्ज डोजेस और ओवर लॉन्गर पीरियड दैन ओरिजिनली इंटेंडेड। ये तीन क्राइटेरिया, टॉलरेंस, विड्रॉल एंड इंक्रीजिंग द डोज और लॉन्ग पीरियड दैन ओरिजिनली इंटेंडेड। एंड 4, decreased control over usage. So number 5, increased time investment in acquisition. सारा टाइम जो है उसको एक्वायर करने के लिए उसको यूज करने में लग रहा है, और रिकवरी उससे रिकवर करने, उसके एक्यूट इफेक्ट से, क्रॉनिक इफेक्ट से रिकवर करने में लग रहा है। डिक्रीज पार्टिसिपेशन इन ऑक्यूपेशनल, किसी काम काज के कोई जॉब नहीं करना चाहता या जॉब कर भी रहा है तो उसकी जॉब इफेक्ट हो रही है। रिक्रिएशनल, फैमिली के साथ वो नहीं टाइम स्पेंड कर रहा, और सोशल इवेंट्स, तो अपने अपने लिए भी उसके पास टाइम नहीं है, सब कुछ ड्रग के इर्द गिर्द घूम रहा है। Then continued use despite social, psychological or physical problems caused by the substance. All this is diagnosis for the diagnosis of substance dependent. अगर ये सारी बातें हैं आपको पता चल जाएगा कि ये आप ड्रग डिपेंडेंस। The recent DSM-4 criterion has eliminated the need for withdrawal and tolerance as criteria to make a diagnosis of substance abuse disorder as opposed to substance dependence disorder. The criterion for diagnosing substance abuse disorders are: number one, hazardous or compulsive use, the role of impairment and recurrent legal problems. जो recent criteria है उसमें withdrawal और tolerance उन्होंने हटा के अब ये तीन criteria डाल दी, hazardous और compulsive use हो, impairment of functioning हो, या recurrent legal problem, getting into trouble against the law, with the law. अब कौन कौन से साइको एक्टिव सब्सटेंसेज जो मेजर जो अल्कोहल जो डिपेंडेंस कॉज करते हैं, इसमें नंबर 1 अल्कोहल है। दिस इज known as alcohol dependence, earlier called alcoholism. It is a psychiatric diagnosis in which an individual uses alcohol despite significant areas of dysfunction, evidence of physical dependence or related hardship. It is more common in males and often associated with drug dependence or abuse. Alcohol dependence has been classified into five types based on the pattern of use, not on the basis of severity. Alpha alcoholism क्या है? Excessive and inappropriate drinking to relieve physical and or emotional pain with no loss of control but ability to abstain is present. Alpha, आप कंट्रोल कर सकते हैं। Beta alcoholism, excessive and inappropriate drinking with physical complications. Example: gastritis, cirrhosis of liver due to cultural drinking and poor nutrition, but there is no dependence. Gamma, this is malignant alcoholism. Physical, there is physical and psychological dependence with tolerance and withdrawal symptoms with ability to control, with inability to control. अभी है withdrawal symptoms are inability to control. ये gamma alcoholism. Delta alcoholism, inability to abstain. There is tolerance, withdrawal symptoms, amount of alcohol consumed can be controlled, and social disruption is minimal. Epsilon and dipsomania and spree drinking, ये बिल्कुल ही आउट ऑफ कंट्रोल हो, मैंने एक तरीके से पी रहा है, या ड्रिंकिंग बोतलों की बोतलें वो चढ़ा दी, एप्सिलॉन. Certain lab markers for alcohol dependence. Gamma glutarate transferase. It is raised with liver enzyme, about 40 international units per liter, 80% of alcohol dependent individuals. Mean corpuscular volume is greater than 92. In 60% of alcohol dependent individuals, thiamine deficiency, मेगालोब्लास्टिक एनीमिया होता है, मीन corpuscular volume बहुत इंक्रीज कर जाता है. तो other markers include alkaline phosphatase, AST, ALT, uric acid triglyceride, and creatine kinase. Gamma glutamate transferase and MCU together can identify Three out of four problem drinkers, 75% of the cases. Blood alcohol concentration and breath analyzers can be used for this purpose also. The treatment can be broadly divided into detoxification first step and then treatment of the alcohol dependence. Alcohol detox कैसे कहते हैं treatment of withdrawal symptom. That is symptom produced by removal of the toxin alcohol. The most common syndrome is the hangover. इसमें क्या क्या होता है nausea, vomiting, weakness, mild tremor, irritability, headache, insomnia. लाइफ थ्रेटनिंग कंडीशन डिलीरियम ट्रेमेंस है वेरी डेंजरस जिसको मेनली आपने कंट्रोल करना ट्रीट करना एल्कोहलिक सीजर्स एंड hallucinations. The drug of choice is benzodiazepine, fluordiazepoxide, 80 to 200 milligrams per day divided dose, and diazepam या आप diazepam देते हैं या fluordiazepoxide. These are benzodiazepines, 40 to 80 milligrams per day divided dose may be used, and vitamin B complex is added. And what is the treatment of dependence? After detox आपने कर दिया delirium tremens को मैनेज कर लिया बाहर ले आए वहां से. After detox is over, there are several methods of for further management. Number one, behavioral therapy. इसमें aversion therapy है. आप डायसल्फिराम देते हैं सिस्टम में जब होगी जब वो अल्कोहल पिएगा उसके बड़े खराब इफेक्ट्स हों. वो फिर एवर्जन होती है उसको अल्कोहल पीने से वो abstain करेगा क्योंकि जब वो पिएगा उसको बड़े खराब इफेक्ट्स होंगे मज़ा आने की बजाय उसकी तबीयत खराब हो. इसको कहते हैं एवर्जन थेरेपी. डायसल्फाम इसका इस्तेमाल रिएक्ट करता है विद अल्कोहल इन अ मैनर टू प्रोड्यूस अ मेटाबोलाइट इसका ब्रेन पे बड़ा एडवर्स इफेक्ट है. तो नॉजिया होगा वॉमिटिंग होगी यू फील वेरी बैड. साइकोथेरेपी एंड ग्रुप थेरेपी. फिर डिटरिंग एजेंट्स या मैं बता चुका हूँ एवर्जन थेरेपी का हिस्सा है. Alcohol sensitizing drug like disulfiram citrate, calcium carbamide, metronidazole, nitropizole, and methyl tetrazole ethiol can be used. एंटी क्रेविंग एजेंट्स भी आप इस्तेमाल करते हैं. एक है प्रोस्टेट, नैल्ट्राजोन, फ्लोक्सिटीन. अदर में ये फ्लोक्सिटीन जो है ये एसएसआर है ये आपको डिप्रेशन से निकालेगा अल्कोहल. अदर मेडिकेशन बेंजोडाइazepine, एंटीडिप्रेसेंट, एंटीसाइकोटिक्स, lithium, carbamazepine, even narcotics can be used, have been used. It is just a combination what works. ओपियोइड एडिक्शन हम काफ़ी डिस्कस करते हैं लेकिन थोड़ा सा इस पे कुछ पॉइंट्स हैं जो मैं डिस्कस कर लेता हूँ. एडिक्शन विद ओपियोइड्स इन्वॉल्व डोपामिनर्जिक pathways. ये एक्स्ट्रा पॉइंट है. And reward circuits that control processes such as hunger, thirst, and drug addiction. जो एडिक्शन पाथवे है वेरी पावरफुल डोपामिनर्जिक पाथवेज इसलिए इसको छोड़ना बड़ा मुश्किल होता है. लिम्बिक सिस्टम को स्टिमुलेट कर रहा होता है. मोस्ट कॉमन डर्मेटोलॉजिकल मैनिफेस्टेशन इज द ट्रैक्स द हाइपोट्रोफिक लीनियर स्कार्स दैट फॉलो द कोर्स ऑफ लार्ज वेन्स एंड अदर मैनिफेस्टेशन इंक्लूड टेटनस हो सकता है, स्किन इन्फेक्शन हो सकती है, एब्सेंस हेपेटाइटिस, एचआईवी एड्स, निमोनिया, एंडोकार्डाइटिस, ऑस्टियोमाइलाइटिस, फैट नेक्रोसिस, लाइपोडिस्ट्रोफी of the skin atrophy, and amenorrhea. Onset of withdrawal occurs within 12 to 24 hours and the symptoms subside with 7 to 10 days of last dose. Nausea, vomiting, anorexia, sweating, diarrhea, yawning, lacrimation, rhinorrhea, tachycardia, pupillary dilation, insomnia, muscle cramps, generalized body aches, anxiety, piloerection, and mild elevation of blood pressure, body temperature, and respiratory rate. The heroin withdrawal is more severe than that of morphine treatment. मैं डिस्कस कर चुका हूँ. इसमें naloxone या naltrexone देते हैं डिटॉक्सिफिकेशन में, मेथाडोन, क्लोनिडीन और naltrexone. अदर ड्रग्स में लीवो अल्फा एसिटिल मेथाडोल, लैम, टोपोक्सिफिन, डाइफेनॉक्सिलेट, बुप्रीनॉर्फिन ये आजकल ये इस्तेमाल हो रही है. एंड लॉफैक्सिडीन प्रोवाइड अल्टरनेटिव टू मेथाडोन यहाँ अवेलेबल ही नहीं है. बुप्रीनॉर्फिन लोग लेते हैं एडिक्शन और हेरोइन. Maintenance therapy methadone is commonly used, but buprenorphine and LAM are considered effective in long-term management. वो relapse को prevent करने के लिए होता है. Opioid antagonists like naltrexone combined with clonidine is effective for detox and maintenance therapy. आप clonidine और naltrexone भी इस्तेमाल करते हैं along with buprenorphine. तो प्रिवेंट रिलैप्स या लॉन्ग टर्म आपने चलाना है, मेंटेन करना है पेशेंट, तो हेरोइन फ्री मेंटेन करना है। अदर मेथड्स में साइकोथेरेपी आ गया, कॉग्निटिव फैमिली थेरेपी, ग्रुप थेरेपी मोड। अगर घर का माहौल क्या है, साइकोसोशल मॉडल आपने इस्तेमाल करना है, तो घर में कौन से फैक्टर्स हैं, कौन कौन से उसके रिलेशनशिप्स हैं दैट कैन प्रिवेंट द पर्सन फ्रॉम टेकिंग द ड्रग, व्हाट इज द सोशल इश्यूज दैट हैज लेड हिम टू द एडिक्शन। डिप्रेसिव फैक्टर्स कौन से, जॉब नहीं है, रिलेशनशिप ठीक नहीं है बीवी के साथ, बच्चों के साथ, what is the trying to isolate the social aspect of the problem, and then social therapy. Next target, cocaine. Cocaine produces a very mild physical but a very strong psychic dependence. Triphasic withdrawal syndrome follows an abrupt discontinuation of chronic cocaine use. So what are the signs and symptoms? Early phase, crash phase भी कहते हैं, बड़ा सीवियर होता है, 9 hours to 4 days तक ये चलता है। There is anorexia, depression, agitation, excessive craving, hypersomnia, fatigue, exhaustion, which is followed by normal mood, anxiety, anhedonia. किसी चीज में मजा नहीं आ रहा, anhedonia का suicidal भी अदला हो जाता है। Next episode. In the third phase, is known as the extinction phase. After 7 to 10 days, there are no withdrawal symptoms but increased vulnerability to relapse. बंदा acute phase में से, crash phase में से निकल तो आता है, अगर निकल आया तो he's lucky enough to get out of it. लेकिन जो pleasurable effects हैं cocaine के, they will compel him to seek the drug. वो relapse के chances बहुत ज़्यादा है cocaine addiction में। Treat कैसे करेंगे? You treat with bromocriptine and amantadine are useful in reducing cocaine craving. Gabapentin is used neuropathic pain के लिए इस्तेमाल होता है, diabetics में भी देते हैं gabapentin. Other useful drugs are desipramine, imipramine, and trazodone, both for reducing craving and for antidepressant effects. Then treat the underlying psychopathology, most important step. The psychological symptoms, the psychosocial treatment techniques like supportive psychotherapy and contingent behavior therapy are useful. Okay. Then cannabis. Cannabis produces a mild physical dependence and withdrawal syndrome. This syndrome begins within few hours of stopping the cannabis use and lasts for 4 to 5 days. Psychological dependence ranges from mild occasional trips to severe compulsive use. Chronic users and abrupt cessation may experience malaise, irritability, agitation, insomnia, drug craving, depression, tremors, nausea, vomiting, and body aches. Hippocampus is said to be affected, which results in impairment of attention, learning, memory, retention, and retrieval. Effects on lungs are similar to nicotine. Chronic use may lead to amotivational syndrome. इसमें चर्सी जो है ना, वो बस बैठा रहता है, कुछ नहीं करना चाहता, गधे को मारते जाओ वो आगे नहीं चलता। चर्सी भी वैसे ही रहता है, क्रॉनिक, बिल्कुल कोई मोटिवेशन नहीं टू एनीथिंग, with loss of age-appropriate behavior like lethargy, lack of interest in day-to-day activities at home and school. Decreased sperm count and sperm motility and morphologic abnormalities of spermatozoa following marijuana have been reported. Since the withdrawal syndrome is mild, supportive and symptomatic treatment is given. Psychotherapy and family therapy are also important in dependence. आप benzodiazepine यूज कर सकते हैं, एंटीसाइकोटिक्स यूज कर सकते हैं in order to treat these cannabis addicts. Then comes barbiturates. They produce marked physical and psychological dependence. Tolerance develops rapidly and is usually marked. There is also cross tolerance with alcohol. Synergistic effect with alcohol. Withdrawal syndrome can be severe and usually occurs in individuals who are taking greater than 6 to 800 milligrams per day of secobarbital, equivalent for more than 1 month. Amphetamines. Amphetamine, it is a CNS stimulant which can be used by snorting, smoking, ingestion, and intravenously. Among common users are students and sports persons who require to overcome the need for sleep and fatigue. Symptoms are similar to cocaine abuse. सीवियस पे acute intoxication के effects हैं एम्फेटामिन के tachycardia, hypertension, hemorrhage, cardiac failure and cardiovascular shock. CNS पे seizures, hyperpyrexia, tremor, ataxia, euphoria, pupillary dilatation and tetanus. Psychiatric में anxiety, irritability, panic, insomnia and hostility. Acute intoxication may present as a paranoid hallucinatory syndrome, which closely mimics paranoid schizophrenia. The mind is racing 20 hundreds of different directions. इतना ज़्यादा बंदा paranoid हो जाता है. Distinguishing features include rapidity of onset, prominence of visual hallucination, absence of thought disorder, appropriateness of affect, fearful emotional reaction, and presence of confusion. Chronic use leads to severe compulsive craving for the drug and high degree of tolerance, 15 to 20 times the initial dose to obtain the same effect. Tolerance usually develops to the central as well as the cardiovascular effects of amphetamine. There are tactile hallucinations may occur in chronic amphetamine intoxication. Withdrawal symptoms include depression, major depression, apathy, suicidal tendency. जब आप इतनी हाई से ऊपर से नीचे आए तो फिर आपको नॉर्मल लाइफ बहुत बोरिंग लगती है. माइंड आपका इतनी तेज काम करना शुरू कर जब इंटेलिजेंस को एक्सपीरियंस करते हैं तो उसके बाद जो नॉर्मल इंटेलिजेंस है वो आपके लिए वेरी डिप्रेसिंग. फटीग, हाइपरसोमनिया, ऑल्टरनेटिंग सोमनी, इंसोमनिया एंड मतलब सुसाइड के लिए बड़ा वनरेबल होता है. द पेशेंट शुड बी केप्ट इन अ डार्क रूम. एसिडिफिकेशन ऑफ द यूरिन उसको किया जाता है ताकि ये यूरिन में निकल जाए. गैस्ट्रिक lavage is done. Acute intoxication is treated symptomatically for hyperpyrexia. Cold sponging इस्तेमाल की जाती है. Cooling blanket, antipyretics. हाइपरटेंशन के लिए सोडियम नाइट्रोक्लोराइड इस्तेमाल की जा सकती है. अल्फा ब्लॉकर्स. सीजर्स के लिए लोराज़ेपैम और डायज़ेपैम. साइकोटिक सिम्टम्स के लिए हेलोपेरिडोल. For withdrawal symptoms, symptomatic treatment, antidepressant and supportive psychotherapy is indicated. Methamphetamine, it is the methyl homolog of amphetamine. It is also known as ice, speed, crank, glass, meth, chalk, crystal, or yerba, has developed into the stimulant of choice for adolescents as it is superior to amphetamine. Crystal meth भी इसको कहते हैं. ये आजकल बहुत पॉपुलर है. Recently there has been a resurgence of the amphetamine use with availability of designer amphetamine like MDMA. इसका नाम ecstasy है. इसको दूसरी ड्रग्स के साथ मिक्स करके ले. One of the drugs included in the dope test for athletes. Now we come to the hallucinogens. Most commonly used hallucinogenic drugs are LSD and MDMA or ecstasy. LSD इसको क्या कहते हैं? Lysergic acid diethylamide acid blotter is obtained from rye fungus and is rapidly absorbed in the GIT with the onset of action in 40 minutes. LSD presumably produces effects by an action on the 5-hydroxytryptamine level, serotonin levels in the brain. Although tolerance and psychological development and dependence occur with LSD use, no physical dependence or withdrawal syndrome is seen. A common pattern of LSD use is trip, occasionally used followed by long period of abstinence. Signs and symptoms. Acute intoxication में somatic और physical में क्या होगा? Dizziness, dilated pupils, nausea, flushing, hyperthermia, paresthesia, hyperactive reflexes, and tremors. Perceptual में altered changes in vision, hearing, hallucination zone, floating, feeling, illusions, sensation of synesthesia, seeing, smells and hearing colors. आपको कलर जब इंसान वो बोलेगा तो उस कलर्स की कलर्स नजर आएंगे मुंह से निकलते हुए. साउंड जो है वो जो है ना वो कलर्स की सूरत में उसको नजर आएगी. आवाज जो है वो कलर्स बन जाएंगे. तो सारे जो आपकी परसेप्शन है ना वो सारी ऑल्टर हुई by LSD, hallucinogenic drug है. साइकिक और चेंजेस इन सेंसोरियम, डिल्यूजनल आइडिएशन हो जाती है, बॉडी डिस्टॉर्शन, अगर आपकी बॉडी को अजीब शेप्स कर जाती है, सस्पिशियसनेस टू पॉइंट ऑफ टॉक्सिक साइकोसिस, डीपर्सनलाइजेशन, दिल लगता है कि जिसम से रूह बाहर निकल आई है, लॉस ऑफ सेंस ऑफ टाइम. ट्रीटमेंट इंक्लूड्स रिमूविंग द पेशेंट फ्रॉम aggravating situation, give anxiolytics, benzodiazepines, symptomatic treatment. MDMA is similar to mescaline, also known as the club drug or rave drug. It is supposed to interact with serotonergic neuron in the CNS, crystal meth. Acute symptoms include euphoria, heightened sensual awareness, increased psychic and emotional energy. MDMA produces less amount of emotional lability, depersonalization, disturbance of thought. Adverse effects include nausea, teeth grinding, blurred vision, anxiety, panic attacks, and psychosis. It has been associated with sudden death due to cardiac arrhythmia. No specific treatment for acute overdose. Only symptomatic treatment is given. Inhalants में आगे they are commonly abused because of their easy availability, rapid action, and low cost. Three major inhalants: solvents with paint thinners, gasoline, glues, dry cleaning fluid, and correction fluid. ये लोग sniff करते हैं. Gases में butane lighters, propane tanks, refrigerant gases, aerosol products, spray paint, deodorant sprays, anesthetic gases, ether, chloroform, and halogen. Nitrites में cyclohexyl nitride and amyl nitride. इसमें euphoria, initially there is mild stimulating effect. Euphoria, enhanced musical appreciation, aphrodisiac effect, sexual energy increases. Is followed by inhibition and syncope. Concentrated amounts of these aerosols may cause suffocation, heart failure, and death. Adverse effects include hearing loss, peripheral neuropathy, limb spasms, CNS, liver and kidney damage, blood oxygen depletion. इस समझ बॉन्ड जो है पेन थिनर्स स्पिरिट्स इनको स्निफ करना, blood oxygen depletion, bone marrow damage, Kaposi sarcoma. Chronic abuse causes behavioral disturbances such as inattentiveness, lack of coordination, and general disorientation. Treatment of acute inhalant intoxication is usually supportive, like providing oxygen and phenytoin for cardiac arrhythmias, Ritilium for ventricular fibrillation, and checking methemoglobin or carboxyhemoglobin levels. कल इंशाल्लाह हम ऑर्गेनोफॉस्फेट्स है ना वो डिस्कस करेंगे, ऑर्गेनो इंसेक्टिसाइड्स जो कि मेजर आपका, और थोड़ा सा ये निकोटीन रह गया, कॉम्प्लिकेशंस ऑफ ड्रग यूज. थैंक यू.